Good morning, everyone, and welcome to today's conversation. We are privileged to have Mrs. Jeanette Sebaeng. She's a nurse educator from the School of Nursing Science, Northwest University, Mafeking campus. She's a colleague of mine, and I'm really glad to have you here, Jeannie. Welcome.
Well, thank you very much, and thanks for having me.
Great. Please introduce yourself.
Okay, good morning, everybody. My name is Jeanette Sebaeng. I am born and bred in Northwest, Zerast, but I'm staying here in Mafeking now, I think for the past 22 years. I am a mother. I am privileged. From last year, I became a granny.
Oh, wow.
So that's to a son, because I do have two daughters, so it's something very new and exciting. I'm exploring it, and I'm a nurse. I normally like to tell people that I am a nurse, irrespective of different roles that I occupy throughout the nursing profession. So I have a clinical experience. I was working in different hospitals for the past 7 years. I started in Rustenburg, Platinum Mine Hospital, and then I moved to Ellen Joseph in Auckland Park.
Oh, wow.
I got back, and I got back to Mafeking Provincial Hospital, which is now home.
Okay.
So I joined the education in 2008 when I joined the college, the nursing college local here, and I worked there also for 5 years.
Mm-hmm.
So this is now my 6th year with the Northwest University as a nurse.
Wow.
So throughout all those different platforms, I have different experiences of nursing and caring.
Mm-hmm. I can imagine that you really were exposed to many circumstances where you saw caring and where you experienced nursing.
Maybe one thing that I can tell is that in all this journey, I worked the most part, especially in clinical, for medical wards. I was mostly Rustenburg, Helen Joseph in Auckland Park, and here in Mafeking Provincial, I worked medical wards, and then I had an opportunity also to in a pediatric ward. Yeah, when I exited the hospital, I worked as a forensic nurse in a Tutuzela care center. That's one of the specialty that I obtained in Free State.
Mm-hmm.
Or maybe I would say, I did not know that I would be a forensic nurse, but when I entered the hospital, I was co-opted to serve in one of the projects leading to the opening of that center. So I felt it won't add any value if I joined the people without any knowledge. That's when I went for forensic nursing. So
okay. Yeah, that's an interesting field, and not many nurses are exposed to that.
It's not an easy field. So maybe talking about, I don't know whether you want me to get straight into this thing of caring presence.
Yes, please.
I would tell colleagues that caring or caring presence is not only about acting, giving medication. It encompasses a lot of things. You can care just by being silent. We normally say in nursing we use therapeutic use of self. But one other thing that I learned as a nurse, especially when dealing with, mainly we're dealing with sexual assault or victims of rape, I learned that also there is what we can say it's a silent therapeutic intervention. Just being there, silent to the patient, making the patient realize that you are present with her, not saying a word. Of course, saying a word is required. says uttering something to the patient is required, and it works for other patients. And in other instances, just being quiet, it's also, it goes a long way. It all depends on the atmosphere and how you present yourself at the moment. So I must say, I had a very, I don't know, that experience that I had when I was dealing with my patients, especially in Tutuza. I cared, of course, for those in medical wards. I bonded with them, but these ones had some special place somehow in my heart. And one thing that was worrying me a lot was that most people are not into the field like you alluded when we start. And I realized that even doctors don't like that part. And I was asking myself that these people need help. These people need to be understood. If I'm not doing it, who else is going to do it? So the whole caring of such victims, I came across a patient of 1 year, 6 months old who was sexually assaulted to a granny of 94 years.
Sure.
So you had to intervene in such aspect. And remember, like I said, I'm a mother. I had 2 sister siblings. I do have a mom also who is a female. I saw myself as a potential victim because it doesn't choose colors, it doesn't choose age. If you see someone 1 year, 6 months, or someone who is 94 years, and it's not about the myth that are available about what you were wearing, how you were behaving, and all those things. So it is a problem for victims of sexual assault in that there's no wound visible to the carers. The crushing pain, that agonizing pain is entailed, it's inside. And until you get closer to the patient, is then that you realize that this person is really having some problems. And the other thing that I also learned is that irrespective of having been subjected to same ordeal, patients recover uniquely in terms of at their time, because one can take something like 1 year, the other one within 3 months can be able to function. Not like they have recovered fully, but at least they are able to resume their daily functions. So it is so important and so crucial for the carers in any way that the patient is comfortable around you about their issues. I remember it's sometimes hard maybe to talk about such events. I remember being with one patient who was subjected to both sexual assault and physical assault. So this person did not have teeth in front because of the physical assault. The person had a triangle-like scar on her breast, which was a hot iron put on her breast. And the person was at some point pricked with, I don't know, with they call it a circle, the one that you used to cut thatch or so. So because unfortunately for nurses, they do care, and there are humans who also need to be cared for. I couldn't absorb that scenario at the moment. So I had to leave the patient with a tissue paper and some water, go next door in the examination room and get myself ready, just revisit that, am I really going to make it with this patient? So it has been horrible experiences happening, someone being sexually assaulted and being pushed with a bottle into. So much as nurses are caring, much as they go to school to train, to be taught how to care, it gets to them somehow. Be it in any type of ward, psychiatric ward, medical ward, surgical, pediatric ward, because it is not normal for any human being to be exposed to someone who is unable to deal with activities of daily living. You see, and then you are there. It's not like it's a privilege. When I joined the nursing profession, there was a myth that there is an injection that you're gonna get, so that all these frustrating issues that you come across, you're able to. There's nothing like that. You just have to be yourself, and it can be draining. We normally talk about burnout, but it becomes a problem for nurses. This one I want to encourage, especially the forensic nurses in this country. Much as they are not yet been recognized, they are doing a great job. They are doing a job that one cannot do for a long time. Maybe I can share with you why I saw it fit for me to leave. I was at some point diagnosed with stress-related, work-related stress, and referred to the occupational health doctor within the hospital. So it's like there was this left-sided continuous pain that I experienced. And because I could not get it right, I was further referred outside. There was a lot of ECGs conducted on me, but there was no problem. So I was referred, and then they said I have a major depressive disorder. And then I said, no, I'm going to be mad now. So this is time to leave this field. But I am so in love with that field in that I appreciate people who are still doing it. That we know our country, it's a violent country. These people still need our care. These people still need our interventions. Now it becomes a problem for nurses who are rendering this service when it starts to hurt. When compassion hurts, it becomes a problem. It becomes a challenge. And it could be probably a problem when compassion hurts, but you are somehow recognized by the authorities that you are rendering this type of care to the patients who need it. So we're still having some challenges in South Africa, but fortunately, through SAFNA, a point was made that this specialty would be recognized somehow in the country soon. Any institution that wanna offer it, they can now. But it has been long. I got my qualification sometimes 2006. So we've been fighting since then for the field to be recognized. But what I want to say is that caring presence. You know, when you are sick and next to someone who is a carer, what they say, what they do, and how they do it lasts longer for the recipient. So it's very, your presence as a nurse, how you walk around your patient, how you talk to your patients, how you even intervene. I normally tell people that nursing is godly. Godly in that it's not about having passion, it's about being compassionate. Because when you are compassionate, it propels you to act. You cannot just sit there and say, shame, when you are a nurse. You need to act and assist this person. And that is why I say it's godly. Now, I believe I am privileged now that I joined the nursing education fraternity. In that, at the college, I would be having something like 170 students to teach, while in university, it could be ranging from 60 to 90. So I instill in my in my students that caring presence either way, because when students, we all know they are mark oriented, they want to pass. But I tell them that when I mark your script, I mark, and we give, it's case based, we teach about scenarios. It's a scenario, but I mark a patient. I normally name the patient, I give the patient a name. So I mark them, and when I come across something that may be detrimental to the patient, and I let you go with that. I am an accomplice. I helped you kill that patient. So it's sometimes pathetic, and it can be demotivating for nurses to be trying to provide care and to not being appreciated somehow. We know what the social media does about the nurses. We know how people themselves talk in front of nurses when they're trying to give care. But I just hope at some point people must understand that any other person can be a nurse through being educated. But why specifically this group of people have decided to be nurses? Then that probably can assist us to be able to appreciate our nurses. Looking also at their working, the hours of working, long hours of working. When I leave the clinical services practice in 2008 for the college, I learned that nurses in the clinical doesn't have life. Their life was so dark in that you wake up, 7 o'clock you're supposed to be in the ward, and 7 o'clock even you also need to leave. So it's dark. You only have that small time for you when you are off, but you don't think anything. You think only about that period, and sometimes you even take your work home. Did I give that patient medication? Did they manage to continue with the referral that the patient is supposed to? You see, so it's like the nurse is working 24 hours. And there's also an expectation when they get home that you should be a mother, you should be a wife, you must assume all those other roles. So, and I would say caring presence is not only for those people who are physically sick. You tend to care everywhere you go, not only in a hospital setting or in a clinical setting. You see someone in need, you start playing a nurse everywhere. That is when real nursing is deep rooted in you. So I believe it's time. It's time. You can think now in the era that we're in. We are calling them the essential services who are frontliners. You wake up, you go to work, you are not sure that you'll be coming back home. So it's only probably human to appreciate them leaving their homes. One can do anything, and I'm so disappointed in that. At some point, I had a database for forensic nurses in the country. When I try to make follow-up, most of them have left because of the type of treatment they are receiving. Most of them have left for trauma, have left for different specialties because they were not recognized. They were told OSD is silent about your specialty, but they are continuing to provide that service. And believe you me, they add much value in that. In most hospitals, it is the doctors and nurses, forensic nurses only, who render that services. So where there is no forensic nurse, it means the very same doctor in casualty must leave and go and attend that patient. So what happens to the patient in casualty when she's not there, and when the nurse is able to render that service? And it's time. It's time. I think South Africa must try to be in par now in other countries. It's time that, well, having it under the programs to be introduced is a first point of departure. So we need to avoid that. It's not only about sexual assault victims, it's physical assault, it's domestic violence, it's motor vehicle accidents, it's pedestrian, it's alcohol intoxication. There's a lot that self-determination, forensic nurses has done, but they were not given a platform to explore their knowledge. So the current practice now is that we are only focusing on sexual assault patients, but there is a lot of arrays of that can be done. And maybe lastly, one specialty again within this field is that they can also work within pathology section with dead patients. We are saying clinical forensic, and we have also clinical pathology, whereby forensic nurses, whom are referred to as coroners especially in the US, are able to also deal with corpses. So I was excited when I see the invitation about caring presence. You can care, you can be present anyhow. Your language, like I indicated, that can mean a lot to a patient. And I must say, all of us at some point have been patients. All of us at some point have been students in nursing. And we have been family members of people who are sick. Now, the very same type of care as a nurse that you want to receive yourself, that you want a family member to receive, I want to urge and encourage my colleagues out there that keep on doing it, irrespective of the situations. We understand there's a lot that are challenging you out there. The working environments, the overburdening of the patients, workload, and probably even the salaries and all those things. But because you have chosen to do it, just do it with that dignity so that your patients always remember you. I'm wondering of any other nurse who was once in a clinical and doesn't recall any patients they wholeheartedly tasked. I can say a lot of such a patient. The last patient that I can tell you about was a patient that I realized that this patient is about to pass on. So with those signs of death, imminent signs of death that appeared, I managed to call the wife and his two sons. Believe you me, the goodbyes. And even when they cried, they were crying, but knowing that they have settled matters. You don't wait for the patient to pass on and call relatives later to say they did not make it. If it goes to a push, the patient is able to talk, it makes life even easier for the ones who are remaining behind. Now you have cared, you have been present for the person who is dying, and also you are present for those who are remaining behind. So that is the whole experience that I had. And upcoming nurses, just learn from the nurses who are exiting the program, who have been long in the field. One of the ladies that I also don't remember, who I believe taught me what nursing is, she is something like 9 years home now after retirement. When she sees the patient, because there was one mistake that the government once made at some point when they talk about step down wards. I wonder if you remember that. Step down wards wherein all terminal patients are kept. So that is palliation sort of. So you will have in 3 days time, you'll have something like 10 patients dying at the time. So it was, and as a professional nurse, every time when a relative comes, they will say, Sister Sebaeng, Jeany, there are relatives for emergency, there are relatives for so and so. You need to go and break those unpalatable news. So it was horrible, and that was a mistake. But during that whole period, there was this old lady. She used to bring along her small radio to work with some cassettes, and you see those rolling cassettes at that point. So it was gospel music. When a patient is about to die, she will bath the patient, play the music, say a prayer, and lay the patient straight. And that one, can't forget, we don't know what happens after death. But what the patient, the experience that the patient had prior to reaching a final death. That was a deeper caring as far as you were talking about caring process, but I saw deeper caring from this woman. And she will do to each and every patient. So really, this is a very, very interesting topic, and I believe it can assist those people who are doing it to say, irrespective of not being recognized somehow, your premiums will be paid one way or the other. And what you are doing, compassionate, it's godly. I'm not a pastor, but most of the time when I read the Bible, I hear that when Jesus comes across someone who is sick, he will show some compassionate and some compassion act. So one way or the other, we could be doing something that the world may not see as significant. The world may not see, the people may see that we are being paid for that. You have been paid, but it's strenuous. Compassion fatigue. You can be coming across people in ICU, people in trauma units. Imagine just trying to save life and it just vanished before you. It doesn't mean when you leave work, you get home, that whole thing is erased from your mind. You leave it several days, months, fades away. And there are some situations you even remember when you were a student. So it just indicates that we are human and we care about each other and we need to be present. Thank you very much. I wonder if there's any question that you are listening.
Thank you so much. You certainly gave us a lot to think about, and your compassion for nurses really shines through. So thank you for that, and all of the best with your work with the Forensic Nurses Association. We will put a link in the description to the association so that we can also spread awareness about that.
Thank you very much.
Thank you so much.
Have a lovely day.
You too. Thank you. Bye-bye.